Okay, so if we're going to be handing instruments, I'll just say I need an Explorer. And the patient's head's right here. And
You do want it ready to go in, or you do not?
Yes.
Okay.
So here I am, I'm ready to go in. Now, I'll hand back the instrument. Go ahead and just act like you're going to take the instrument. Go ahead and grab a hold. See the instrument transfer right there? Are you able to capture that, that angle? Now I'm going to let go. Keep your hands right there. Now that's the position that you should be handing the instruments to me, so that I'm able to pick it up from here and go in, or go down, or going up. So always think about how my hands are going to be. Let's contrast that with, let's just imagine you're not handing it to me the right way. Let's say I asked for the instrument, you hand it to me like that. Well now, you see, I can't really have enough to grab a hold of here. If I grab up here, then I have to turn it around, and then I gotta flip it this way. So think about where my hands are going to go and create that space for me to grab that instrument. So that would be a very nice transfer right there. Let's say you need the,
this is a no. This is a yes.
Yes. Okay, so now I can go in to mount then work. And I hand this back like this. Again, the assistant needs to meet the doctor, not the doctor trying to find the assistant. So if I say, okay, I'm done, I'll just lift it up like that, and then the assistant will come in and grab the instrument and go from there. Because the doctor's focus is going to be down here in the patient, they don't need to look up and then start trying to find the assistant. The assistant needs to be assisting the doctor. So let's go with the micro brush. Let's say we're getting ready to place a filling. And so the micro brush is going to be, we're going to be doing a lower. So let's imagine we're doing a lower tooth. Now she's handing me that brush that way, because you see I'm going to be going in like this, going right into the bottom. She did not hand it to me like this. Now if I was doing an upper, that would be the correct way to do it. And this brush actually should be bent at about 45 degrees, like that way. So then we're able to go in and work on the upper, and then we're done, I just hand it back. Now when she go ahead and hand that back to me again. And one thing I'll make sure of, I'm just going to turn your hand this way, notice the brush is not touching her gloves. You don't want that touching the gloves, it just might throw off the chemistry of the bonding agent. So hand it, you can kind of choke up on the handle here, but just make sure that this brush tip is not hitting the gloves. So yeah, so go back in, and we're done. Another typical problem that I see is if I'm asking for a mirror. I've seen assistants hand instruments. I'll just kind of hold on to that for a moment, and they'll just hand it to me like, just kind of hold it like this. They'll just kind of hand it like that, which means I have to reach up, over, grab, and turn. I kind of exaggerated that movement, but that's kind of how you should not do the instrument transfer. So I just flick this out like that, you're ready to go, pick it back up, go ahead and retrieve the instrument, great, and I hand it back, see, and that's it, perfect. Alright, next thing we're going to do is cotton rolls. Whenever I'm placing cotton rolls, I like to have the assistant put, I'm asking for cotton rolls, plural, usually take about 3 or 4 of them, and she'll cradle them in her hand like that, and then with the other hand she'll have this instrument. And actually,
still doing a lower?
Yes, but what I would like is to just hand me this without cotton. Just don't even grab the cotton, because you see, if you do it that way, see, you had to go and apply pressure. Then I have to come over here and make sure I grab and maintain the same pressure. I just prefer it to just be a naked instrument. So I'll go ahead and hand that to me, and then I will then go in and place, and then she's here available for me to place again. Contrast that with an assistant who will hold on to it finger and thumb, and then I have to try to get the right angulation to grab, but I have to come in like this in order to go in. So it's just better if you just cradle them in your hand like that. That way it's just easier to pick them up and go. I can go upper, you can pick it up and go lower. So again, just cradle the cotton rolls right there in the hand. And then when I'm done, just hand that back, and that's it. We're finished with that. I think there's probably no other instruments I can think of. So that's instrument transfers. Okay, so now we'll transfer a hemostat. So we'll unlock the hemostats. Okay, so I'm getting ready to go in. You notice how she's holding on to the beaks, which is perfect, and it's positioned for me to be able to put my fingers up and in and go to work. Now we're just going to assume that in that position I was going in to go work on the lower. If I had to work on the upper, well, it would be flipped that way. Again, able for me to put my hands right in there, as opposed to handing the instrument, if you just want to hold it right there. If you hold it right there, I mean, that can work, that's okay, but down here by the beaks is a little bit easier. And again, just think about the hand, or the angulation of the doctor's hand. if the doctor's going to be coming in like this, just kind of picture where should this be to line up with this thumb and finger. It needs to be right there. So the doctor can just pick it up and go. And then when the doctor's done, he'll take the beaks and then just hold it still while the doctor finagles this back out. Again, you don't want to maybe be turning it this way and this way because then the doctor has to keep craning his arm around, or his hand around. Just go like this, and if anything, you can crane it back this way. It makes it easier. So just make it so that the placement of the finger and the thumb is easy, and the removal of it is just as easy. Same thing with the scissors. Same concept. I just have to know which way we're going. Typically, we're going to be cutting on the excess piece. Like this is a piece of retraction cord or a piece of floss. Go ahead and cut that for a second. And pick it up. Can you see the curve of this? Okay. Now, if I was going to go in, let's just imagine this is either a stitch or this is a piece of retraction cord. When we go in, and this is the excess piece that needs to be cut off, this is how we would like to cut it. We want to have the have the curve, the outside curve, going up against where my fingers are, as opposed to this. We don't want that because you see, then you're blocked. You don't have as easy of access to get in and clip that. So it's better to have it handed that way. So then we can go in, snip, and then hand the instrument back. And again, it's the same thing as with the hemostats. Grab it by the beak, and then remove, and we're done. So that's the angulation thing. Okay, when it comes to anesthetic, we've got the syringe. We have two different kinds of needles. We just call this the blue tip. We call that one a yellow tip. This is a short, skinny needle. This is a long, slightly fatter needle. The three different types of anesthetic we use most of the time would be, what I just call this the black cartridge, and this is 4% setonous plain. I use this on the upper. What this does, since it doesn't have epinephrine, it is allowed to disperse in the tissues without as much sting as these other two. However, it is a more weak anesthetic, so it's not as good as these other guys, but it is good at the beginning. But it really only works on an upper infiltration. On a lower, we really haven't found a difference between going in with this versus the stronger red cartridge. So for the lowers, we're just going to go right in with the red. On the gold one, actually I'm going to go back to this for a moment. The red one is actually your standard lidocaine. 2% lidocaine with 1 to 100,000 epinephrine. Epinephrine is a part that's added to this anesthetic that does act like adrenaline in that it does make the heart race a little bit. So it's not unusual for patients to feel like their hands get a little shaky or their heart race a little bit after this has been put in. The same thing goes with this one, which is septicaine. It's also called articaine. It is also 1 to 100,000 epinephrine, so it too has got the same effect. And I will use the gold one, the gold band. I use the gold one for upper infiltrations. That usually follows the black one. So if we're doing an upper tooth, what we would do, we put on a blue tip, break the top, put that on, and we would load in the black one. The hub, the rubber part goes down here at the bottom. We drop that in there, and then, I don't think we can show this on the camera, but there's this little black part right here. That is actually, I can grab an instrument. That's actually a piece of rubber. Of course, this is metal on the outside. And this rubber piece is going to have to fit into this metal silver part of the needle. Those two are going to join together like that when it's all put together. Now, this is inside. Okay. Drop this all the way back, drop this into place, and then you'll have to look, it's hard to show this on the camera, but you have to look to make sure that that needle part is right in the middle of this barrel, and then slide that together. Now that's all together. But give it a hit like that. That puts this plunger harpoon in the back side of this rubber stopper. Take off the tip, give it a test, and you can see there it squirted out some anesthetic, so we know that we've got anesthetic flowing through this needle. So again, this would be, if I was going to go in and do an upper, this is where I'd go in first. After that's put in place, I would then take this out, and I would put in the gold one and go from there. Now if it's a lower one, I will also start off with the blue tip, but I will put in the red cartridge and put that into place, and then give the shot. We'll let that set for a minute or two, then I will take off the blue one, I'll then put on the yellow one and load up another red cartridge and put that in the patient's mouth. That seems to be what gives us the most predictable anesthetic on the bottom. So, to recap, there's 3 anesthetics. We have red, black, gold, 2 tips, blue and yellow. And when you set up at the beginning for every shot, it's always going to be a blue tip right away. And then we may or may not go to a yellow one depending upon if it's a lower. And black if it's an upper, we start with that one. Red on the bottom, we start with that one. Yeah, so that's anesthetic. One common, well I should say common, happens from time to time is this gets put in there, and then when an anesthetic cartridge, same thing. When that gets put in there, if this rubber piece isn't lined up, this will hit the metal surrounding. So instead of it going in like, is that showing up on the camera? Instead of that going in like this, we have to zoom in. Instead of leaning forward, just zoom in. Okay?
Okay.
Good. So, I can edit that out.
No,
All right.
you should leave it.
So, this metal piece here is supposed to go inside. It's supposed to hit this black bullseye. If for some reason this becomes a little bent when it goes in, if it hits this metal hub, what happens is it gets bent on the inside, and then when you go try to squirt, you'll notice that this plunger is not moving at all, and there's no anesthetic coming out the end. So typically what that means is you have to take this back off the syringe, and you'll notice it will have a nice bend to it. So no big deal. Throw it away, grab a new one, and try it again.